Hi everyone, we're back again. Sharon and I will discuss naman the treatment that I did here for the past 3 days.
3 days.
3 to 4 days. 4 days pala. I have one more tomorrow eh. So this is our third day.
Today is your third day.
Okay, so on the first day, can you please tell our viewers what are the treatment that you did to me? Yung blood to check
It's nice.
how,
Right?
yeah. Okay,
It's so
game.
easier. Anyway, so what you did,
The first day.
which is the first day, this is a standard protocol for all the clients. First is we will do a very simple diagnostics. Yeah, but prior to coming, you remember you also submitted your blood tests.
Okay, so not everybody is qualified to do stem cells. The reason you have to send, it's parang inyong partial application to them if you are qualified to do stem cells. So you will give your patient a list of
list.
laboratory.
Yes.
From there, that's where you base it if
Yes.
it's the patient is candidate for
Yes,
stem cells. So
exactly.
that's what I had to do. Then you will I got an email
What did you do?
that I got accepted.
Yes, exactly.
Diba?
Yeah.
Parang, so they're very honest. Kasi pag, I know if you have a certain illness, you don't suggest to do them as stem cells,
It's
right?
true.
Kasi it might trigger
Yes.
whatever the existing already.
Yes.
And you have to declare all your existing disease. Like if you have hypertension, diabetic, all that is very important.
All the
Even your cosmetic surgery, the procedure that you did, the medicine that you're taking, regardless kung ano man yung antihistamine, man allergy or what. it
Your
has to
level
be.
of stress, your level of anxiety,
Yes, yan.
how many hours you sleep.
Yes, so
we
you
need
have to
know
tell
these
them
things.
that's when that's where you based it. So you study the initial, the laboratory.
Together with the laboratory. So, let me tell you more about the blood test. So,
Okay.
our blood test requirement for EW Villamedica Bangkok is very intensive. Some of the blood tests are not they're not included in your executive checkup.
Yes.
Okay, so for example, the tumor markers.
Yeah.
Some of the cancer markers are only being done to clients with cancer.
Yes.
They don't do that one on your executive checkup.
No, they
Some,
don't.
okay. However, what we do here is we also want to do the full tumor markers because it's a prevention.
Yes.
Because
yes.
regenerative medicine, where our clinic is preventive medicine as well. Okay, so for example, when you have the tumor markers, when it is elevated and then it
chances
corresponds
are.
to another blood test that's also elevated, we will try to inform you like, okay, this one is high, please see a specialist.
Yeah.
We will guide you. So from there, the specialist or the doctor would request for further testing,
Yeah.
do an ultrasound. If they say something on the ultrasound for further testing, then you have to follow first the
Yeah.
advice of the doctor.
Okay, so there you go. So like in my case, one reason that made me do this already, okay? My family history have so many illness. We have diabetic, heart disease, cancer, hypertension, how do you call it? Acid reflux,
Acid
and then I had,
reflux.
okay, yung inoperahan ako sa kidney ko. So, diverticulitis.
Diverticulitis.
Yeah. So they removed 1/4 of my intestine last year. So, and then another member of the family has been diagnosed a couple years ago with cancer, which is, I think, my turning point. Na parang I need to do it. So, and I don't want to inherit yung illness ng parents ko, because I've seen how they are when they were sick.
Yeah,
It was hard for them.
it is.
Plus, of course, hindi naman kami ganon financially stable.
Exactly.
So, it came to a point that I almost sold my property for my dad's dedication.
Oh.
Yeah, there's one point, and then again, helps came in. Oh, sorry, nagiging emotional ako.
I would understand.
Yeah.
There's many.
So I don't want my children
True.
to go through the same position that I went through before.
Yeah.
And so as much possible. So this hindi po to cure.
Yes.
It doesn't mean that I won't be able to get all those diseases.
Yes.
Okay? But it's a prevention.
True.
Okay? So just to correct you, hindi po nila matedetect, matatanggal yon sa DNA mo.
Yeah.
That's already in your DNA. What Villa Medica doing is to prevent that to happen to you. So if you continue your treatment, like yearly, if you can afford,
But also.
but this is the best investment that I did in my entire life.
Exactly.
Kasi yung shopping mga bags na mahalin, luxury bags, tulog sila ngayon.
True.
And then you travel business class, you buy Birkin, you buy Dior. That after that's how many hundreds of thousands. But this one,
What are you gonna do with your Birkins and everything if
If
you're lying
you're
on
gone.
the bed?
Exactly.
You start with lying on the
Yeah,
bed.
you start lying in the bed.
Nothing, you cannot do anything.
You can't enjoy that anymore. So, I'm actually started to, I already have something to do with my lecture, so I can do another treatment next year. Hopefully, I
No,
can
but-
do another one next year.
But there's nothing wrong with having Birkins.
No.
Because you work hard for
You're
it.
feeding your
It's your
happiness. It's your
happiness.
reward.
But you
I'm
have
not
to
saying,
take
but
care-
then
yes.
again, save some for your health.
Prioritize.
Prioritize your health. It's more important that you invest on your health.
Yes.
More than anything. More than anything. Shelter, yan. Shelter, importante yan. Kailangan may tutulugan tayo, may kinakakain tayo, and your health.
Yes.
Because if you're healthy, you can do many things.
True.
Your life, it will be extended to 100 years old or whatever.
But let me get back to you was saying like with the information. Remember we would also ask you like a family medical history.
Yes.
So when you
That's
see
why
there,
yeah.
if there is diabetes, hypertension, and mind you, diabetes, hypertension, stroke, this one, it's a normal thing
Yeah.
that we would always treat here, okay? So, but then, if you already know that your parents have, it's in your medical, family medical history that you have diabetes, it's a prevention, there's a way to it. Meaning to say, you already know that if you're gonna be going through this side with your diet and nutrition, with
Yeah.
sugar, no discipline with everything,
Yes,
you're
yes,
gonna go that way,
Yeah,
right? So it's
You have to
actually your
discipline.
choice,
Yeah.
discipline and everything,
Discipline and everything.
and
Yeah.
proper information.
Stem cell will just help you to start.
Yes. Kumbaga, it's like reboot.
Yeah, nire-reboot niya.
Reboot, regenerate
And
the
clean
damage.
the damage. And clean the damages.
Yeah, the damaged organs and everything to make them perform at optimum
Yeah.
functioning.
Yeah. So if you wanted to do this also, I would recommend, me personally my recommendation, after doing all my research, the Germany and Bangkok, I decided to fly to Bangkok because I've seen a lot of cases that they did.
Yes.
And I'm very happy. So, and I was so excited when I got
I
you know
know.
yung high mo when you pass in a let's say board exam on your or final test, 'di ba? Nag-graduate ka na.
Because it's a
Ganun yung feeling ko na parang oh my god, accepted ako.
It's a different
Because-
journey. Not
yes,
everyone
yeah.
can do. Not
Yeah.
everyone can receive.
And not
the
everybody
treatment.
can also afford this.
And I mean, another thing
But-
also is the reason why not everyone can receive the treatment because of our principle in taking care of clients. Okay, you have to understand that number one, that a client would be disqualified if a client has cancer.
Yes.
Why?
Existing,
Existing cancer.
hindi siya
Why?
pwede.
Because stem cell or any kind of cell therapy is cellular regeneration and
So might
rejuvenation. Pero
umak-activate.
this one is based on our principle. It's
Okay.
under our principle, okay?
Mm.
That we do not provide any kind of stem cells or cell therapy to clients who have an existing cancer. Because once you inject any kind of stem cells, you will also try to regenerate and rejuvenate
The cancer.
cancer cells. Even they are already post-cancer
Yes.
patients, you have to wait for a certain period.
Yes, actually may narinig akong ganyang case. Parang ginawa pa rin nila kahit may cancer yung pasyente.
There
And
are
she didn't
s-
last long.
there are some that they
It
would
works.
do it and then they live longer. Well, then maybe it's a different kind.
Depends on
of-
the case. Yeah,
Depends on
it
the
case to case basis also.
Yes.
How bad is your cancer?
Yes, exactly.
It's true. So like yun nga, yung isang friend ko hindi siya candidate.
Oh.
Yeah. So
I see.
she wanted to do it but then parang they're trying sabi ng doktor niya, i-clear mo na natin then they'll
Yeah.
see if you can in the future pag maayos na pag nawala na yun sa system.
If clients have cancer, we do not turn them away, you know. We would always try like, okay, there are some other alternative,
Yes.
you know, alternative treatments, but for us, not cell therapy, you know.
So on that note, we'll come back and for the next episode. Swipe, like, comment, and subscribe. Remember, okay? See you guys later.
See you.